Hi, I'm Dr. Julie Steinauer, and today we're going to talk about a really big topic, ADHD and vision. The reason why is that October is ADHD Awareness Month. So I have a lot to cover, and in fact, today might even look a little bit like a press release or like you've turned into a news station. But before we go into that information, I do want to tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You'll have two choices there. The first one is probably the best one. If you've been following me for a while and watching my YouTube videos, it might just be time to stop everything and take some action on getting to a better place visually. If you're ready to do that, then schedule a consultation with us. The next thing that is an option available to you, if you're not quite ready to take that leap and you really just want to kind of gather more information, then tool around the website. Also, feel free to take the questionnaire. In order to receive feedback about your questionnaire, you will need to enter your email. Now, let's unpack. There's a lot of information today to cover on ADHD. So first and foremost, as I said earlier in the title of this, October is ADHD Awareness Month. So let's give you some statistics to think about and mull over. First of all, according to the CDC, 6.1 million kids in America have been diagnosed with ADHD. That accounts for approximately 9.6% of all children at ages 3 through 17 in the United States. Now, according to the NIH, or National Institute of Health, adults are diagnosed about 4.4% of the time. And there is a slight more increase of prevalence in males as there is for females. And this is across the board in adults and in children. Now, let's look at the prevalency in other countries. Now, what's interesting is that I could only find data on this in my quick little research. I found some data that was a couple years dated, but I do still feel like it's relevant, even though these numbers may be statistically higher now a couple years later. So in kind of like in comparison with United States, which we're saying the prevalency rate is approximately 9.6% in children, there are some studies out there that say it's closer to 11% in children in the United States. But how does the US stack up to other countries? Well, let's look at that. So in China, 0.7% of the population of children are diagnosed with ADHD. In Iraq, 0.1% of children are diagnosed. In Brazil, 2.5% of children are diagnosed. And in France, 4.7% of children are diagnosed as having ADHD. Now, again, this data and statistics is from a couple of years ago. So, don't kind of lynch me for the fact that you might have seen that France now is a 6.2%. So this is just one of the articles that I ran across. We realize in all data, there is some give and take. And so these percentages may be increased in some studies, or they may be slightly decreased in other studies. That's just kind of normal. Now, let's unpack something else. What does it mean to have ADHD? Like, what are the symptoms associated with it? Well, there's a lot. Okay, so I'm going to kind of run down a ticker tape. They're not in any particular order. They're not grouped together based on behavior versus psychological versus something else. They're just all over the place. For the purpose that I want you to understand, this is kind of an all over the place type of condition that we don't have tons of information on. And I'm going to point to that in just a bit. But here are some symptoms: impulsivity, hyperactivity, hyper-talkative, changing topics often, interrupting others, fidgety and distractible, inability to sit still, decreased attention spans, trouble with focusing, aggression, mood swings, depression, repetition of words and saying the same things over and over again, trying to prove points. Learning disabilities are common. Excitability, absent-mindedness, and trouble finishing tasks. Again, that's a lot. And if any of us are watching this video and thinking about it, I could fall into some of these categories pretty easily. However, I wouldn't diagnose myself as ADHD. Would you? All right, let's move on. So there's more things to talk about. According to the Mayo Clinic, while the exact cause of ADHD is still unclear, genetics may play a role. This was just information that I took again off of a quick Google search. And this is a direct quote from an article from the Mayo Clinic. Now, while ADHD is one of the frequently misdiagnosed disorders across the entire world, let's look at some things that it kind of gets interchangeably confused with or misdiagnosed. And these are very interesting. There's quite a lot of things that you can look up. I picked kind of the top 5. And number 1 on the list, which was really interesting, is called the nature deficit disorder. Well, what this means is that kids who are sitting indoors, playing on video games, playing with devices, phones, or watching TV are much more likely to have this diagnosis than children who are out in nature. There seems to be an association, this article mentioned, there is an association with the amount of light that kids receive, vitamin D that kids receive or take, and in addition to that, the amount of seeing green that plays a part in this misdiagnosis. Now, a couple of other things that are easily misdiagnosed, where people might say it's ADHD when it's really something else, are sleep disorders. We all know that a good night of sleep is absolutely crucial for our health, overall well-being, and even just emotional, psychological, and mental well-being. So if a person is not sleeping on a regular basis, including a child, it tends to make them irritable, full of anxiety, and a bit hyperactive, almost like a little bit too much coffee or caffeine. Now, while coffee and caffeine and those sorts of things were not listed here, that is another factor, is that kids who take an intake, maybe I can lump it into this one, poor diet. That was one that was listed. So if coffee, caffeine, hopefully not coffee for kids, but caffeine, lots of sodas and high volumes of sugar and carbohydrates is absolutely associated with, a poor diet, as well as a lot of various problems such as learning disabilities and ADHD. So there can be some strong misdiagnoses. Other things lumped into this poor diet category can be things like, a child who eats a lot of foods that have dye in them, like red dye or blue dyes. Another misdiagnosis commonly that kind of gets easily confused and can look like ADHD is emotional trauma and anxiety. So there is kind of a group of psychological, emotional, mental health and well-being disorders or diagnoses that can all kind of get listed as wrongly ADHD. So the last area of common misdiagnosis for ADHD, which happens to be probably, I don't know if my favorite is the right thing to say, but certainly my area of expertise is definitely appropriate. And that is misdiagnosing binocular vision disorders or vision problems, and kind of saying that because there is a visual problem going on, it may look like there's something ADHD, and the child ends up misdiagnosed as ADHD instead of the root of the cause being really just vision problems causing them trouble sitting still and focusing. Okay, so let's unpack the binocular vision problems and vision problems in general and how it can look kind of like ADHD. There is a condition most often associated with the diagnosis of ADHD, and that's called convergence insufficiency. What that is a condition or problem where a person has trouble lining up their two eyes and crossing them to a target at the same time so that both eyes are in the same space, lined up, and ability to take and gather information from what they're doing. So for instance, with reading, if one eye is on track with the subject matter that they're looking at to read, and one eye is kind of off doing something else, or loses its ability to stay focused and goes off to do something else, That's what's considered to be convergence insufficiency, the inability to continue to keep two eyes lined up to a singular point in order to stay focused on it and see a singular object for a length of time. Now, again, this is commonly misdiagnosed. So from our standpoint, what we want to convey is that vision should certainly be something that is looked at as number one, when instead it's often put to the really back burner of many other things. And oftentimes we jump to the conclusion that ADHD is going to need medication in order to correct it. It may, but it also may not. And if we find out that there is a binocular vision disorder, such as convergence insufficiency, such as maybe problems with tracking, which is common with children who look ADHD, also focusing problems, eye alignment issues, there are a multitude of things. And lastly, another one that is huge that plays a factor visually is a small visual field or functional visual field ability in a child. Most children who actually get misdiagnosed as ADHD will tend to have a really small tubular or tunnel vision type of functional visual field. And what that means is we can do a quick little test together. Okay, so in this type of kind of testing, what we're going to do is we're going to maybe show you, maybe it's better to say it's an example, but we're going to show you what is it like to have a small functional visual field, and what does that actually look like in your child, maybe even yourself as an adult. And what that is if you close an eye, so let's close or cover an eye, make kind of a tube with your hand. You can make it large, but I like to close that circle off and connect my fingers together. So that still is a pretty big tube, but not big if we consider that a functional visual field should be kind of like this overall for both eyes. So we got one eye though, that functional visual field should still be about like this. Okay, so if we're down to here, that's a pretty small tube or tunnel of vision. But if we go even smaller, like this, barely making a hole with the hand so that only a finger can poke through the end of that hole, sometimes that's what we see with children who are wrongly misdiagnosed, no wonder, as ADHD. Now, with this little test or example, what I'm going to have you do is just close that eye and then kind of walk around and sample your environment this way. What happens? Okay, I'm going to tell you, if I do this and I look across the room, I see my light switches. I see like a little knobby thing on the wall. What do you call those knobby things that catch the door so it doesn't bust the wall through? Okay, with this teeny tiny tube, well, what happens with reading? Let's just see. I happen to have some information here about a next topic for a video. But if I do this, I see approximately 5 words at this space. If I bring it in closer, which is the normal reading space for most kids, I see about 4, 5, if you include little connector words like of and the in there, at a time. If that happens to be even smaller, like the tip of a pencil that we see, not really a pencil tip, but a eraser point of a pencil, sometimes that's the amount of visual field, functional visual field, that we're able to find in kids who are misdiagnosed or mislabeled as ADHD. Now walk around like that all day long. Do steps, pay attention in a classroom, pay attention at work. Just see how you feel comfortable. Try to maybe cook, all right? Now don't do anything dangerous. But my point of this is that if you do that, and if you try to function with that smaller visual field, you'll notice how excruciatingly difficult it is. And then you might be able to understand why your child, who is having trouble sitting still, having trouble focusing on what they're reading, is interrupting, is just kind of like a bull in a china shop, may not be able to pay attention to social cues and things that are going on around them because this functional field is just so small. And if that's the case, should we not want to try and correct that condition before we jump to the conclusion of putting someone on medication? Again, doesn't mean that they don't need it, but if we get to the root of issues and we resolve the root of issues first, it may not truly be ADHD, as we've seen here, nature deficit disorder plays a factor, sleep issues play a factor, anxiety, psychological, emotional, mental well-being issues play a factor, and trauma. Poor diet, red dye, caffeine, too much sugar, they all play a factor. And certainly we know vision is number one, actually. These do kind of take a back seat because the way that we interact with our world, 80% of what we do is visual in nature. So we're processing visual information all the time. And if we're processing through this teeny tiny tube, do you think we're processing well? Do you think maybe this could explain why your child looks like they're bouncing off of the walls? Could it be that they're really just moving around a lot, sampling their environment? They're really, really fast. They're hyper excitable. There's lots of stuff going on, so much to see, and they don't even know if they're safe in the world. Could it just be that? So we're here today unpacking a lot of information. Again, I told you it would be a little bit like a press release, maybe, as I'm reading stuff off of paper, which I don't normally do. And this is a longer video, but there's a lot to unpack. And I think we need to not be hasty and jump to conclusions when it comes to something such as a serious diagnosis as ADHD. Number one, it's a label. Number two, it's something that may be misdiagnosed and we go down the wrong pathway. And number three, we might be putting kids on medications they don't really need, which could potentially cause other issues. So while those medications can certainly be helpful if your child truly does have this, we're just here today to say, let's look at all of the possibilities. Now, what do we do to correct this in our clinic? Because we need to cover this today. Even though this video is like 17 minutes long, hang with me if you want to learn more, because what we do in our clinic is we do work with children and adults who feel like they have these symptoms or feel like they are ADHD, or maybe they are even diagnosed as ADHD, because we're working with the true root of the problem if there's a visual issue going on for them binocularly. As mentioned before, convergence insufficiency, tracking, focusing, eye alignment, tons of things could be going on visually that need to be unpacked and corrected. And they are able to be corrected. The way that we do this is we use two phases of a treatment program in our clinic. The first phase is using Syntonics, which if you've seen any of my other videos, go watch all of those. I'm not going to talk about that in detail today. But Syntonics is a form of light therapy where kids and adults wear glasses with different colored filters that electrically reset different things within the brain. And so we can kind of reset the programming and how the brain functions with vision and how it processes visual information by using these glasses. Phase two then is a hands-on component, teaching your child or yourself a better way to focus, align the eyes if that convergence issue is definitely a problem, and many other things are addressed in the kind of hands-on phase two part. So it's really teaching you to use tools and pieces of equipment to gain better vision and the connection between the brain and eyes processing information more accurately and efficiently. Now, if this has been really interesting and you feel like this could explain some things about yourself or your child, then you have to connect with us. Give us a call if you're local, 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. Once you've done a little bit of research, done some digging in, and you're ready, the next step, if you're not local, is to schedule a consultation with us. Do that whenever you're serious about getting help for possibly, let's not just slap a label and put medication on this, but let's actually get to a true root and see if there's something visually that needs to be corrected. If that's you, then schedule a consultation with us. As always, I'm going to end the video by telling you, if this is, good information, which I think it's definitely worthy, and you know someone who could be concerned about this diagnosis or possibly just received this diagnosis, pass this video on. There's a lot of information here. It could literally change someone's life and also stop and prevent them from going down a needless pathway of medication and labels. And if you like the video, hit like. If you haven't done so already, please subscribe to our channel so you get all notifications of our videos and you don't miss a thing. Thank you.